We want to thank you so much for taking time out to be here. Let me acknowledge our Permanent Secretary in the Ministry of Health and Wellness, Mr. Dunstan Bryan, the Permanent Secretary from the Ministry of Labor and Social Security, Mrs. Colette Roberts-Risden, Dr. Jacqueline Bisesa McKenzie, our Chief Medical Officer, Dr. Karen Webster-Carr, our Principal Medical Officer and National Epidemiologist, Dr. Simone Spence, the Director of Health Promotions and Protection, and Dr. Nadine Williams, the Director of Health Services Planning and Integration Services at the Ministry of Health and Wellness. We'll now take this statement from our Permanent Secretary and to be followed by other presentations. Please welcome our PS.
Good afternoon, ladies and gentlemen of the press. Thank you for joining us in what we hope to be a constant engagement with you as our principal communicators to the national environment around COVID-19. In the last 24 hours, the National Influenza Center has made available the results that we were tracking from yesterday, 11 test results. Of the 11 test results, 2 positive were identified for COVID-19, and the remaining 9 were negative. It is on a sad note that we announce our first death from COVID-19. The patient tested positive today and died today. Jamaica now has a total of 15 confirmed COVID-19 persons. Today, we are awaiting the results of 6 tests, which are now at the National Influenza Center. One of the positive cases that were tested in the 11 is linked to the first patient, patient 1, while the second is our new patient with a travel history from New York. The Chief Medical Officer will give more information on this patient. Of note, 458 persons have come into the island from a country of interest since January 31. 25 persons are now in government facilities for quarantine. 91 are in home quarantine, but note that this number does not include those persons who are in community quarantine in 7 and 8 Miles Bull Bay. And 28 persons are currently in isolation in government facilities, hospitals that is. Our enhanced medical surveillance continues in the Bull Bay area, and surveillance activities include the mapping by our senior public health inspector, and this mapping includes each head of household answering screening questions and the temperatures being taken. If a positive sign of fever or symptoms to elicit the team being of concern, this information is collected and the relevant actions are taken. Arrangements have been put in place for medical officers to be on call in the community for medical direction in the community. Pharmacy services continue to be offered by the National Health Fund, and the Drug Serve mobile unit has been assigned to provide pharmacy services. The Bull Bay Health Center is open and will be open on Tuesday, of next week, and will provide curative services. The Ministry of Labor and Social Security continues to provide support, social protection support to the community, and the Permanent Secretary will give more information in that regard. I now invite the Chief Medical Officer, Dr. Jacqueline Bisesa McKenzie, to come and give some more particulars on our first death.
Good afternoon, everyone. Okay. Our first death occurred today. This is a 79-year-old male from Clarendon with a travel history from New York. He is known to have diabetes and hypertension. He presented to the Lioneltown Hospital on the 16th of March with fever, cough, and shortness of breath. And that time, he was noted to be critically ill and was transferred to the Mandeville Public General Hospital, where he was isolated and treated. The patient had shown some improvement yesterday, March 17th, but today his condition started to deteriorate. His test came back positive today for COVID-19. He continued to deteriorate today, and during the process of transferring him to the University Hospital of the West Indies, before he was able to leave the Mandeville Public General Hospital, he demised at approximately 3 p.m. The family has been informed, and the public health team are currently on the ground, both at the home and at the hospital, to put in all the necessary efforts to make sure that we contain this possible source of infection.
So I will now invite the Permanent Secretary for the Ministry of Labor and Social Security to give an update on the social protection support that is being provided to the Bull Bay community. Also, we will take questions right after her presentation.
Afternoon, everyone. The Ministry of Labor and Social Security, we play a critical role in providing welfare support to those usually in the aftermath of a natural disaster, but this is a different kind. So far, as we speak now, there are teams on the ground delivering welfare packages to families, and to date, at the end of today, they would have distributed approximately 900 packages to families. The areas that were covered include St. Thomas Road, Parle Road, Morales Road, Main Road, Shooters Hill, the seaside along the main road there. We work with a joint team from the Ministry of Labor and Social Security and Red Cross. They have been very instrumental in assisting us with packaging of food items. And I want to use this opportunity to express publicly the government's appreciation to Food for the Poor, the private sector organization of Jamaica, Industrial Sales, Excelsior, Crackers, and a number of other companies who have come forward to donate items for the families. The families not only receive food, but they also receive hygiene packages, which include basic things such as toilet paper, soap, and a small bottle of bleach in some instances. We continue with the distribution as the need arises, but I want to also use this opportunity to say that the team we do have some challenge on the ground because we do have a number of families who want, should I say, to abuse the system and want to get multiple packages of food. Let me just say no, that we do have enough, and the team will be going out tomorrow again to continue distribution for any families who didn't receive, and to also go back to the first set of families who received on Saturday. Thank you.
Before we take questions, I need to use this opportunity to provide some information on contact tracing. So I'm going to ask Dr. Karen Webster-Carr, the Chief Epidemiologist, to come and provide, the National Epidemiologist, to come and provide some clarity. We have a chart here that shows how this is done.
Good afternoon. What we are showing on this chart is that we have 7 chains
of transmission for the positive cases. Four of the transmission chains are single persons. Four of the transmission chains are single chains. The first one has 5 persons that has been transmitted. So 1.1, 1.2 to 1.5, 1.5 being the one that was identified today. Then we have another chain, which is 3. It involves persons with a similar travel history. They came together to Jamaica, and so they are likely exposed outside of Jamaica or were exposed outside of Jamaica and probably had similar exposure. So we are not sure if they passed it to each other before or after they came to Jamaica. Likely before. The number 4 is related similarly, a group of persons who traveled from Malaysia, Dubai, Trinidad to Jamaica together. And they are likely have a similar exposure. They went to a religious function or festival, and they were, in that area, they had confirmed cases that came to light afterwards. So we are supposing that these were related and they were similar exposure outside Jamaica. They just became ill. One became ill before they arrived and one after arrival. So these are the persons that we have positive, the 15 positive cases.
Thank you very much, Dr. Webster-Carr. So we will now take questions. Yes, if you could.
Oh, no? Okay, great. Vashon Brown from TVJ. Help me with some timelines here. You said the patient presented at the Lioneltown Hospital on March 15th. What symptoms what symptoms are we seeing at that point, and when exactly was the person tested?
CMO.
Okay, so this case is now just being investigated. The person presented to hospital on the 16th, not on the 15th, okay? We got the sample yesterday, and so the testing started yesterday, and we're confirmed the positive this morning. In terms of all the symptoms and when the symptoms started, the public health team are on the ground and they're collecting that information. As soon as we get that information along with the contact history, start the contact tracing, we'll be able to provide more updated information.
You spoke about when the sample was received. When were the samples collected from the person?
I cannot say exactly when the sample was collected from the person. More than likely, the sample would have taken from the person presented. So from it became a suspected case, there's a travel history, a person is symptomatic, then they're classified as suspected and a sample would be taken. But the sample then would have to be received at the National Influenza Center for testing. So we know that the sample was received yesterday and the process of testing started yesterday, and we got a confirmatory positive this morning.
Dwayne Anderson, TVJ. I'm sure many Jamaicans listening in would be panicking now that news has come of a first death. What would you say to them? And also, what are the statuses of the other 14 persons who are being treated?
Okay. So as of this morning, for the 14 persons that are under treatment, now we have 13 persons that are stable and are doing well. 3 are totally asymptomatic now, and we will start their discharge testing shortly. We have one person that has been in our care for about, I think, 5 days, and that person has some chronic illnesses and is showing symptoms, some symptoms still. And there is a little, this morning when we spoke to the team on the ground, they said that the person was, not critically ill, but still ill. Right, so I just want to, just to refer to the chart that Dr. Webster Carr spoke about. The cases that we are seeing that are, for the case that has demised, did have several risk factors, okay? An elderly person with chronic illnesses. And again, we want to emphasize that these are our high-risk groups: chronic illnesses, elderly patient. I also want to emphasize that in terms of transmitting the disease, this is where the contact tracing is important, okay? So in terms of passing on the infection to persons, you realize that based on our contact tracing, we really have had very limited spread, okay? So, and remember now that even in coming up for patient 1, where we have 5 persons that are positive, we have contacted hundreds of persons. Out of those hundreds of persons, a small subset of persons that have actually had reasonable contact, and only about 20 persons were symptomatic. And those persons have been isolated or quarantined and have been sampled, okay? And most of the tests are coming back as negative. We only have these 5 that have come back as positive, okay? So in terms of spread, we are not seeing that great spread. I think that the public has been sensitized in terms of staying at home. If you have symptoms, stay home, contact us, and we will guide you in what to do. And this is how we are going to be able to contain any of these centers of transmission that we have. Because as you notice, we have 3 other cases. Well, the case that has demised is new on the board, so we have not done all the contact tracing as yet. But for the other 3 cases, we have had the persons that we have contacted, very, very few symptomatic persons, and the persons that have been symptomatic have been tested negative. Okay? So it really is a matter of the public. The public has been acting. They have been realizing that persons who have symptoms are to stay at home. Okay, if you have had contact with someone who you think has been confirmed to have COVID-19, stay at home. I think that is the message. Stop the transmission, stay at home. Okay.
Test.
So before we take the next question, I just want to make the point about the rationale for the quarantining of community and how effective the quarantining of community is. You'll notice that patient 1 from that community that we have quarantined was able to transmit to 5 other persons. Now, if we had not moved quickly to cordon off and prevent the community from moving outside of the geographical zone, these cases would not have been isolated, and we would not have been able to contain. Most of these positives that we found were from our quarantine facility when we moved the household persons from the household to quarantine facilities, and we were able to identify early when the onset of symptoms, and we moved them into isolation, tested them, and we were able to identify the positives from that process. So it's very important that the public understands why it is that quarantining is an effective tool for containment, and why it is that though there are hardships that will come from quarantining, the output of quarantining is so much more. And so if we really want to contain, we really have to maintain the robustness of what we are trying to do, as pointed out by the CMO. If you are unwell, stay home.
Okay, hello again, Brittany Clark, Nationwide News. Okay, I have a few questions. I'll ask them as we go along. So firstly, is the breakdown in terms of numbers of patients per parish available as yet? Secondly, when did the 79-year-old, the person who died, when did he return to the island, and has his information been released to the public in terms of for contact tracing purposes? And thirdly, have the medical officials been able to notice any trends in terms of the recovery of the patients, whether or not there is an observable or anticipated recovery time, and whether there is a fluctuation of condition, whether they fluctuate between stable and critical? Is that information available at this time?
Okay, so we can advise in terms of the contacts that are being followed across the different parishes. These contacts come out of the interviews that have been conducted around the communities that the confirmed cases are coming from. So while there may be several more persons that have been interviewed, we have narrowed down those persons to who are the true contacts, the persons that we are actually following up, all right? So in Clarendon, we have 21 persons that are now being followed. In Hanover, we have 3 persons, Kingston and St. Andrew, 224 persons, Manchester, 2 persons, Portland, 6 persons, St. Anne, 26 persons, St. Catherine, 9 persons, St. Elizabeth, 5 persons, St. James, 114 persons, St. Mary, 22 persons, Trelawney, 2 persons. A total of 434 persons that are presently being followed. Some persons may have dropped off this list because they were symptomatic and were tested and were negative, so they would have been pulled out. So these are persons that the parish health teams are following up on a regular basis to determine if they have any symptoms. In terms of symptomatic contacts that are identified, we have 32 symptomatic contacts that were identified. And as I said, these persons are followed closely. Some of them are in quarantine facilities, or I should say isolation facilities, and have been tested, and some of the results have already been available.
Nicoy Wilson from the Gleaner.
Before you, may I acknowledge the Honorable Minister of Health and Wellness, Dr. Christopher Tufton. Welcome, sir. I don't know if you would like to come and join us here. Go ahead.
Yes, so today I did a visit to the community. I spoke with a few residents, and they were concerned, or rather they expressed that they didn't think the quarantine made much sense because many of them actually know how to get out of the community. So I wanted to know what the ministry, what the team is doing to ensure that persons stay within the quarantine zone.
First and foremost, I'll ask the minister to come up and respond more, but I want to make it abundantly clear that the quarantine that has been put in place is the law. Breaking the law can have severe consequences, as was articulated by the Attorney General. The reason why we put quarantining into place is to protect you and to protect the entire society. And therefore, as we move through this epidemic, we have to utilize different tools. Yes, we can use a big stick of the law, but what we want more importantly is moral suasion. And we want people to feel that their compliance is for their own good. And therefore, it's self-compliance and self-regulation that we are trying to encourage, a behavior change, because we are going through the crisis together. No system, even in a SOE, a state of emergency, no system is perfect, and you will never have 100% compliance when it comes down to human behavior. no matter how strict the rules are. But we are encouraging persons to understand, and we can see from the evidence, as pointed out in this chart, the effectiveness of quarantining. If we had not put those restrictions in place, what could have occurred if those positive cases that we have now identified from our first case was able to move throughout the community and the wider Jamaica? Just think of the impact of that and realize that because we acted early and because we acted swiftly, we were able to contain any further spread from any further spread. All right, Minister.
Okay, thank you very much, ladies and gentlemen. So today I visited the Bull Bay area to see what was happening, given some concerns that were raised as it relates to persons who are from the community. I visited with the support of the Ministry of Labor and Social Security, and had an opportunity to interact with the security personnel on the ground, both the JDF and the constabulary, as well as the medical team, and of course the Ministry of Labor, who is administering the food supplies. And then had an opportunity to speak with some of the residents. The concern from some members are that they need some more personalized attention as it relates to food supplies and medication. You know, I can appreciate that some persons may have that concern. The truth is that when the quarantine announcement was made in the early stages, persons would have had, under normal circumstances, supplies for the next day or a day or two. Over time, however, it is quite understandable why some persons would run out of food supplies. And as a consequence, more effort or more support would be required. Remember now, to the extent that they observe the quarantine is the extent to which they can't leave the community or should not leave the community. And frankly speaking, the socioeconomic profile of the community suggests that many of those persons' disposable income would not allow them to stock up for a month or 2 weeks of supplies. So it's very understandable why some persons, even if they are not indigent, which would have been our first focus, over time would require support. I think the Ministry of Labor and Social Security have been doing a lot. They have been delivering quite a number of food packages. I've seen the packages for myself. I think it's quite substantial. We, however, took the decision that we would increase the number of packages that would be delivered to the community. So we would now make more available. And I visited the warehouse where the packing was taking place, or is taking place, and we co-opted and got the support of the private sector to donate a fair bit of additional supplies, which will start rolling out, if not already, tomorrow. So to the citizens of 7-8 Mile Bull Bay, you will see more food packages going in. On the issue of the medication, we took the decision there in terms of the presence on the ground for persons to report where they are having difficulties as it relates to other support that they need. Now, it's very important to state that within the community itself, there are, or certainly today, there were about 15 health workers on the ground, and I understand it's a daily occurrence, interviewing, doing temperature checks within the community. So a number of persons are present in the community, and therefore persons have the opportunity to outline any concerns to them. But nevertheless, we will increase that to place someone at the main security post so that they can have additional support to voice any concerns that they have. I say all of this to say, in relation to the question that was asked, that part of the temptation to leave the community is a view or a perception that they are not getting what they would be accustomed to. And one of the reasons for the discussion, for the visit, and for the decision to expand what is available is to attempt to make the citizens as comfortable as possible while they go through this period. It is impatient of debate, having listened to the Permanent Secretary and the CMO, and you've seen the graph here, that the decision that was made around quarantining that community was a right one. It is obvious. I mean, 30% or a third of the cases so far are linked to that index case. And the truth is, if that wasn't done, a lot of other things could have happened. So I really want to commend the team because it was a right call, the right call. But having said that, we do have a responsibility to ensure that the persons living in the community who are being quarantined are given the maximum or the best possible treatment. And we're going to be doing that. And my visit was to try and address that, some of those shortcomings, if there were any.
My other question is, so the patient who just died from the COVID-19 complications, I'm being told that he was being transferred to the UHWI to be put on a ventilator. Is it that only UA has a ventilator? And if that's the case, understanding that this is a disease that really affects the respiratory system, what real chance of survival do the elderly have if they do contract this virus?
The person was being transferred for intensive care, which is a little bit more than just being put on a ventilator. I mean, we do have ventilators in our hospitals. However, in terms of intensive care facilities, that is where we do have a critical shortage. This is why the ministry is moving to get more ventilators, more high dependency spaces. And the spaces does not just include the ventilator, but all that goes with it. So we do recognize that there is a shortage in this area. It was not that there was a lack of a bed for this person. It was just the timing of the movement of the person, because we have to assume we have to get some amount of stability and have everything in place before the movement can occur. So all the arrangements have to be made, and all the arrangements for transfer as well. So it's not that there was a lack of space for this person, but it's just that in the process of, the patient did deteriorate quite quickly, and so sometimes we are not able to time these things to allow the interventions at the right time. But we do recognize that there is a critical shortage, and therefore in planning for this and in anticipating that there would be more need for these beds, that is why we are moving to get these beds in place. Okay.
Can I just say too, in relation to that point being raised by the Chief Medical Officer, that I'm being advised that since the start of the process to prepare the, for want of a better term, the COVID wards in our hospitals, which means identifying isolation areas in every hospital across the country. I'm told that that has gone fairly well, and there are approximately 240 beds that can now be classified as isolation beds based on each hospital establishing an isolation ward. Now, I'm sure more work needs to be done in terms of the various equipment and so on, but nevertheless, I want to thank the respective hospitals, the SMOs, the CEOs, and others who have followed the directive as part of the preparation to isolate an area for COVID patients should the need arise.
Excuse me, Balfour Henry from the Observer. I didn't hear the Permanent Secretary respond to the question about when the gentleman who died returned to Jamaica. Did you? I think that was asked earlier.
Right. So we are in the process of getting the information now. Okay. I can tell you that the person was admitted at Lioneltown Hospital on Monday the 16th. In terms of verifying all the other information has to be come in, and then we will be able to verify those and to pass it on to the public. Because if it needs that, we have to trace back to when the person came into country. We have to determine when did he start having symptoms. Was it that he came into the country with symptoms? Did he start having symptoms when he was here already? Those things have to be determined.
But you're sure that he's a Jamaican?
It is a Jamaican.
And he lived in the United States?
Mr. Henry, I don't want to give you any wrong information.
I'm
Allow
just
us
trying
to
to find out
verify.
how much you know.
But our information is that it is a Jamaican who returned from New York.
And he lives in Clarendon? I mean, his family is in Clarendon? Is it?
I cannot tell you his home situation as yet.
But that's where he was. That's where you.
He was in Clarendon.
What?
Yes.
Where in Clarendon?
Mr. Henry, as soon as we get all the information, that we'll be able to pass it on. Mm-hmm.
And it's on that note that I want to make a point. We are getting too many reports of discriminatory behavior towards persons who are presumed or suspected of being infected by COVID. And it is becoming problematic in that people are denying services. And we have to intervene. Because now that we have had a good nearly 2 weeks of this operation, we are going to start the process now of what you call discharging patients, and the CMO made mention of it. And we have to integrate persons into communities. They have to begin to normalize their lives after they leave hospital. And if we generate this amount of discriminatory activity, it can cause severe outcomes that we do not want to occur within our society. And so we have to be cautious around how we manage the information and how we create any sort of anxiety within the public. As was pointed out by the CMO, the case that we have today is part of the high-risk group that COVID-19 will impact negatively. Elderly, comorbidities, meaning having chronic diseases in most instances. And therefore, we have to manage that information and let the public know that the recovery rate for COVID internationally is moving in the right direction, and it is showing that only 20% of the persons, under 20% of the persons who get the infected become even ill enough to want to go to hospital. And so we have to send that message out. We have to send that message out. It is not a death sentence. Right? Okay? Yeah? All right? So, yeah, sorry.
Yeah, man, Dwayne Anderson again from TVJ. This particular death and some of the early positive tests point to persons who just returned to Jamaica. Are the protocols at the airports not working so that these persons or carriers can be flagged early?
Are the protocols at the airport not work so that the person can be flagged properly?
Okay. So as you know, initially we had put in the restrictions on certain countries where there were large numbers of cases. We have now moved to that persons that are returning from any country where there is active transmission, that these persons should home quarantine. I think this re-emphasizes the position of the Ministry of Health and Wellness that it is important that persons self-quarantine. Persons who are returning from countries where there is active transmission of disease must self-quarantine. Call the Ministry of Health if you develop symptoms, and we will be able to guide you. It is better you call us, we are able to assess what your symptoms are, direct you, and be able to receive you in a facility than to have you moving throughout the population. So this is an effort, it is to contain any illness that there is. In terms of, somebody asked earlier about panicking. I would say to the population, now is not the time to panic, now is the time to act. Now is the time that you must become more aware. You must become aware of the personal measures that you need to take to protect yourself and the measures that you need to take to protect your family. If you have family members that are returning from countries where there are active transmission, and it is very clear that 10 persons out of our 15 cases are imported cases, that is very clear. So if you have relatives, if you yourself have returned, then stay home. For the general population, even if you don't know if you have had contact with somebody who have had COVID, if you are sick and you are having flu-like symptoms, cough or cold, stay at home. Our numbers are available for you to call. Not everybody is going to get through at the first time they call, but call again, because we are working 24 hours to answer those calls, to settle people's mind and to provide them with help. Don't panic. It is really time for everybody to take a part in controlling and stopping the transmission of COVID-19.
I realize that the signal is being sent for a wrap-up, so I'm going to try to make this question into like 3 parts. One, A, B, C. First of all, obviously this is a country of many people with NCDs, so I'm sure they would want some sort of assurance. One of those assurances I'm sure could be the supposed drug in Cuba. What is the status of our attempts to get that drug if it is indeed available? Also, has the Prime Minister been notified of this death? What has he said? And is there a COVID-19 case in Mandeville?
Well, I'll start with the last one. So you know that we have a person isolated who is a father of the first case at Mandeville Hospital. And then we had this person who died, who was at Mandeville Hospital. So far, we have not received any other notification in the National Surveillance Unit. But notifications are coming in every day and they are reviewed. So things are fluid and they will change. But as of now, those are the 2 persons that we are aware of in Mandeville Hospital. We had a person that was at Percy Junior Hospital. That person was tested negative and has been discharged home. So that's Manchester. That wraps up Manchester for us. What was that question? The drug. Okay, so we realize and we have been getting information on a lot of treatments that are there across a lot of countries. We have gotten information on what is happening in Cuba, and we are reviewing that information to make a decision as to how it is that we will utilize this, if it is necessary, to help in the treatment of our population. So we are reviewing the data presently on that matter. Okay.
All right, so I think the other question is quite easy. Yes? Right? You asked me if the Prime Minister has been notified. Yes. Okay, so this is, we're going to bring a close to...
Sorry, just one final question. Vashon Brown. We have gotten reports about a popular entertainer who entered the country without declaring that he was somewhere where there was local transmission. Do you have any information about that? That's one. And 2, is the government actively thinking of declaring any other quarantine zone?
Okay, so as it relates to that information that you have read the entertainer, I would say that I have heard also, and I've asked for an investigation to take place. I would prefer not to comment until that investigation takes place, so that I don't make any errors or accuse anyone of anything. But we will certainly investigate it. We expect, and it is required by law, that persons coming into the country, particularly as it relates to from countries of origin that are on the restricted list, that they declare, and if they fail to declare, then they would have committed a breach. And to the extent that we are aware of that, then we will take whatever action is necessary. It's very, very important, because we cannot afford to compromise or undermine the programs that we have because someone decides that they will not show respect for what is being prescribed. Our decisions are based significantly on the clinical advice that we get, and it is good public practice, public health practice, and it is also a legal requirement. The other question about other quarantine areas, I'm sure you'll be the first to know if we decide. They haven't said that to me, the clinical team, and so I'm assuming that it's not yet at the top of their minds. I'm sure I'll be the first one to know, and you'll be the second. Well, the Prime Minister and then you guys, all right? Thank you very much, I appreciate the time. I want to just close by expressing our condolences to the family members of the individual who passed on from COVID-19, our first case. I believe that on behalf of all of us in the healthcare system, and indeed the government and the people of Jamaica, our prayers go to the family members, and we will remember them at this time as we continue to try to overcome this challenge. Thank you very much, and we'll be in touch.